Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss typical cervical vertebra. Do you know what is the most distinctive features of the typical cervical vertebra? Do you want to learn about cervical vertebra using modern imaging techniques? Please watch the video until the end. Cervical 3 to cervical 6 are the typical cervical vertebra because they share the same basic characteristic. This is vertebral column and the smallest vertebral body are present at the cervical region and the largest one are lumbar vertebra. The function of the vertebral body is weight bearing and it spread the weight from the vertebral column to the sacrum and pelvis. The body of the typical cervical vertebra is smaller and broader side to side than anteroposteriorly. The length of the anterior surface and posterior surface of the vertebral body is the same, but the anterior surface of the body is placed on the lower level than the posterior surface. So, the inferior border is prolonged downwards and so overlap the upper and forepart of the vertebral below. The upper surface of the body is concave transversely and present a projecting lip on the either side known as the uncus of the body or uncinate process. The lower surface of the body is concave from front to backwards and side to side convex, and two sides there is a depression, a concavity which articulate with the underlying uncinate process. This is the pedicle of the cervical vertebra. They directed laterally and backwards, and pedicle attached to the body midway between its upper and lower border. So the superior vertebral notch and inferior vertebral notch are the same diameter and narrower. The laminas are long, narrow and thin above than the below. This is the lamina of the typical cervical vertebra. They curve posterior-medially. Lamina within cervical region are slightly more than those of the thoracic region. The greatest lamina thickness is thoracic 2 and least was cervical 5. Ligamentum flava are a series of ligaments that connect the ventral part of the lamina of the adjacent vertebra. They help to prevent upright posture, preventing hyperflexions and ensuring that the vertebral column straightens after flexion. Vertebral foramen is large and triangular in form, and cervical 1, these are the diameter in different cervical level. The diameter of the vertebral foramen in different level of the vertebral column, and diameter of the spinal cord and the cervical region 13 mm and in lumbar region 6.4 mm. The other ligament connect the cervical vertebra, the interspinous ligament. It is thin and membranous ligament that connect adjacent spinous process of the vertebra in the spine, and they attach with the ligamentum flava and also the ligamentum knuckle ligament. This is knuckle ligament. It's extend from the external-occipital protuberance and up to cervical 7. Beyond cervical 7 is continue as the supraspinous ligament. The spinous process is short and bifid, the two division being often of unequal size. Cervical vertebral spinous process are so short, certain superficial muscle, the trapezius and the spinous capitis attached to the knuckle ligament rather than directly to the vertebra. The articular facet is flat and oval from the superior articular facet is directed backwards, upward and slightly medially, and inferior articular facet is directed forward, downward and slightly laterally. So this is the location of the superior articular facet, this is the location of the inferior articular facet, they are not the same level. This is the thoracic vertebra, the level of the superior inferior articular process is the same, and in lumbar region this is also in the same region except the fifth lumbar vertebra, they are not in the same level. The superior inferior articular processes of cervical vertebra has fused on either or both sides to form articular pillars, column of bone that project laterally from the junction of the pedicle and lamina. The transverse process of the cervical vertebra is short and house foramen transversarium. The upper six of the foramen transversarium contain vertebral artery, vertebral vein, and plexus of sympathetic nerve. But 7 foramen transversarium lodge only vertebral vein and plexus of sympathetic nerve. Each transverse process consists of anterior root and posterior root, and two parts is joined by a bar of bone known as the costotransverse bar, and it contains a deep sulcus and which lodges the spinal nerve. The anterior portions is the homologous of the rib in the cervical in the thoracic region and is therefore named the costal process or costal element. Costal process or costal element. It is raised from the side of the body and directed laterally in front of the foramen and end in a tubercle, anterior tubercle. This is posterior part and it is the true transverse process, and it directed forward and laterally, it ends in a flattened vertical tubercle, the posterior tubercle. Radiology and imaging. Normal X-ray. Ear is black in normal X-ray, bones is white, and soft tissue is gray in color. So this is the bones, this is ear, soft tissue, bones. Ear, soft tissue, bones. CT scan also like this. This is here look like black, soft tissue gray, and bones white. This is the anterior portion of the body of the cervical vertebra, and from anterior margin of the vertebral body. This is posterior margin of the vertebral body. This is posterior margin of the spinal canal. This is lamina. This is spine. This is tip of the spinous process. So the fourth line is anterior posterior vertebral line, spinolaminar line, and posterior spinous line. And this is the location of the foramen magnum, and the vertebral canal contains spinal cord. First cervical vertebra, second cervical vertebra, the all cervical vertebra, only vertebral bodies, only lamina, the lateral mass of the cervical vertebra, the facet joint, intervertebral foramen, spinous process, intervertebral discs, nasal cavity, heart palate, teeth, nasal cavity, heart palate, teeth, nasopharynx, oropharynx, laryngopharynx, larynx, trachea. So this is nasopharynx, oropharynx, laryngopharynx, larynx, trachea. This is hyoid bone. This is rectopharyngeal space. This is rectotracheal space. Rectopharyngeal space is narrower than the rectotracheal space. Normally it is 6 millimeter, but rectotracheal space is wider. It is up to 2 centimeter. So this is the normal X-ray, the narrow rectopharyngeal space. Here disease condition, wide rectopharyngeal space. This is other imaging technique. The volume rendering technique is a type of data visualization technique which creates a three-dimensional representation of data derived from the CT and MRI scan. The abnormal enlargement of the right interventricular foramen, cervical 4 to 5. Fluoroscopy is a type of imaging procedure that uses several pulses of a X-ray beam to take real-time footage of tissue inside your body. Detection of the spinal instability. A myelogram is a diagnostic imaging test generally done by the radiologist using a contrast dye and X-ray or computed tomography to look for problem in the spinal canal. So this is the spinal canal, and this is the spinal cord. This is spinal cord, and this is CSF. This is CSF. This first cervical vertebra, the second cervical vertebra, the intervertebral foramen, nerve roots, foramen transversarium in the MRI scan. This is all about this video. If you like this video, please press the like button and please share this video and subscribe my channel. Thank you for watching.